Let's talk about diet in pregnancy. Namaste. I'm Dr. Mithee Bhanot, Senior Consultant Obstetrician and Gynecologist, Apollo Hospital Noida. Diet forms a very major part of our pregnancy, which ultimately helps us in having a healthy mother and a healthy baby. The first 3 months of pregnancy, our patient is dealing with nausea and vomiting, which is usually normal in pregnancy. Little bit of nausea and vomiting is normal in pregnancy. But we must take a diet which does not increase this nausea. So what we should do is we must have our meals, small frequent meals, small portions every 2 hours, small frequent meals. That is important. Secondly, we must avoid too much of fatty or too spicy foods. All these can increase our nausea. The other thing is that we must have a lot of fruits and a lot of salads, a lot of leafy vegetables, especially in the first 3 months of pregnancy, because that helps us in preventing constipation also. Another integral part is having a lot of water in the diet. Water in the form of any other liquid like lassi, like chaach, buttermilk, coconut water. All these help us in avoiding constipation during pregnancy. Then, once our nausea and vomiting settles, we must now concentrate on the nutrition part of our diet. Our diet should be well equipped with proteins, carbohydrates, and fibers. That is a very important form. Coming to the proteins, major part of a diet should be based on proteins. The normal requirement is somewhere around 1.5 gram per kg body weight of a pregnant patient. So, proteins should be around 60 to 70% of our diet in each meal. Coming to the types of proteins, the vegetarian sources are all the dals, the pulses, paneer, then coming to sprouts, then coming to soya. This is a very rich source of proteins in the vegetarians. In the non-vegetarians, we have eggs, chicken, fish. So limited portions of each and different kind of proteins should be taken with every meal. Then leafy vegetables, a lot of fiber in the diet. These include lots of fruits, lots of vegetables, leafy vegetables, salads in each meal. All these help us in preventing constipation. This is very important. The baby weight is dependent upon a lot of factors, one of the major being the diet in pregnancy and mostly proteins. The more proteins we take in our diet, it directly influences the baby weight. And if we have a good baby weight towards the end of delivery, towards the end of pregnancy, there is a good chance that the baby and the mother has a normal delivery because the baby is of a good weight and is able to take the stress of labor and helps in having a normal delivery, a healthy mother, and a healthy baby. So, with every meal, whatever you plan, depending upon the place where you belong, the state where you belong, have local food. Most of your diet, 60 to 70%, base it on proteins in the diet in whatever form you like to take, pulses, you like to take non veg, but that should be a very important integral part of your diet. Then the salads which we take, like with every meal, the kind of salads which you take, the fruits which you take, you should avoid juices because juices just give us sugar and take away the fiber. And our main aim with fruits and vegetables is that we take a lot of fiber with it so that it helps us in preventing constipation. So a good amount of salads, a good amount of fruits in the diet also help us in pregnancy. The things which we need to avoid are processed food. As little of processed food we should take in the diet, as little or maybe minimal processed food. Every meal should be freshly made, freshly cooked food is what we should take every meal, the breakfast, the lunch, and the dinner. Avoid packed food, avoid frozen food. That's all, these are the basic things which we need to take care. The hygiene needs to be maintained. Every time we eat our food, we must wash our hands and make sure that the food cooked for us is also hygienically prepared. Thank you.